There are a lot of misconceptions that are associated with infertility. One of the more common misconceptions that we see a lot in our couples is, if I've had a baby in the past, it must mean that I should be able to have babies now. The interesting way of looking at that is to ask yourself one of three questions. The first question is, can I acquire conditions that can affect my future fertility? And the simple answer to that is yes, you definitely can acquire certain conditions that will affect your future fertility. The most common condition that affects both men and women are infections, usually sexually transmitted infections that affect both the male and the female tubes. Remember that men also have tubes, even more than women actually. And once those tubes get infected, once they heal, they form adhesions, and that can block the tubes. It means that in the men, if the tubes are blocked, the sperm can't travel to the outside, and then that affects obviously your fertility. There are also other conditions like fibroids, there's trauma. Men can get a varicocele where one of the blood vessels gets blocked, and that affects the temperature within the testes, and that can be detrimental to sperm, and then that can affect your fertility. So the first way that your fertility declines is that you can acquire a medical condition that affects your fertility. The second way is exposure to environmental factors. The biggest one is obesity. So the older we get, usually, the slower our metabolism. That means we are at predisposition to getting fat and getting obese, and obesity affects both our ovarian count and follicular development, but it also affects sperm development. So it affects, again, both male and female. Also, smoking, alcohol can also affect your future fertility. The third thing is, the older you get, or the greater your age, the greater your chance of being infertile. So your fertility declines with age, and that again is for both males and females, but it is mostly highlighted in women over the ages of 35 because their ovarian reserve starts declining after the age of 35. So the easy answer to that is that it does not mean if you have children in the past that you are still have the same fertility potential as you did back then.